TRITON3 is a registrational trial looking at Rucaparib for patients with metastatic castration-resistant prostate cancer who harbor aberrations in either BRCA 1, 2, or ATM. It's a randomized controlled trial, 400 patients, randomized between Rucaparib or standard of care therapy with the physician's choice of docetaxel, abiraterone, or enzalutamide. It was powered to look at radiographic progression-free survival as the primary endpoint, looking first in the subgroup of BRCA aberrant disease and secondly in the subgroup of ATM aberrant disease. So we presented here today the primary endpoint of rPFS, as well as some of the subset analyses and secondary analyses looking at response by treatment arm and response by genetic aberration and the interim overall survival. So the top line data is very good. Importantly, this was a positive study, clearly demonstrating the superiority of Rucaparib over physician's choice of therapy for patients with mCRPC and the BRCA aberration who have progressed on at least one androgen pathway inhibitor and who have not seen docetaxel in the castration-resistant setting. As it was, patients who received docetaxel in the hormone-sensitive setting were permitted, so that comprised approximately 20% of the patient population. Very strong results showing a 50% risk of progression or death for patients randomized to Rucaparib over the physician's choice of therapy. So, really exciting to present these results here today. Clearly a practice-changing trial. Still a question for regulators to review in terms of drug approval, so not anything that would be implemented in practice today. But nevertheless, the clearest result, the largest PARP inhibitor study in this space, the first time we have seen a PARP inhibitor beat a docetaxel-containing control arm. Docetaxel has been the standard of care in prostate cancer for nearly 30 years now, and this is actually the first clinical trial we've ever had where a experimental therapy or the experimental arm has beat a docetaxel-containing control arm. So, really very happy to have presented this study here today. Clearly a practice-changing result, and the question will be where this fits in to the paradigm moving forward as the PARP inhibitor space continues to evolve, and we've seen multiple other studies addressing this question. But Rucaparib is clearly an option in this space for these patients and should be part of the conversation moving forward for treatment consideration.